Hello friends and doctors, let's talk thyroid. So today we will be discussing about overt hypothyroidism during pregnancy. So there are two situations where someone can have overt hypothyroidism during pregnancy. If a lady already has hypothyroidism prior to conceiving, then what we need to do is right after conceiving we need to get her TSH levels checked. Usually there is a requirement to approximately 125% of the preconception dose of thyroxine during the time of pregnancy. So the TSH should be checked as soon as possible. Whenever the lady gets to know that she has conceived, the pregnancy test is positive, TSH should be checked immediately, and even if the TSH is normal, the thyroxine dose should be increased by 25% of the previous dose. So if somebody is on 100 microgram of thyroxine, the dose has to be increased to 125 microgram. So this is for some lady who is already having pre-existing overt hypothyroidism. If somebody gets diagnosed during pregnancy, just after conceiving, if the TSH is high, if the TSH is more than 10, we need to start thyroxine immediately. Usual dose will be around 1.6 microgram per kg of body weight. You might even consider a slightly higher dose because the lady is already pregnant. Checking should be after every 4 to 6 weeks. If the target TSH should be in the range of 0.5 to 2.5. If it's more than that, the dose should be increased. If we are able to reach and maintain a steady TSH between 0.5 to 2.5, most of the complications associated with hypothyroidism during pregnancy can be avoided, and the testing frequency can be decreased once every 6 weeks. So by following these simple steps, we can offer a lady with thyroid disorder an uncomplicated pregnancy, and most of the complications related to thyroid can be avoided. So the very important step is that the lady needs to take it early in the morning, empty stomach, should be ideally avoiding any sort of food or tea or breakfast for next at least 30 minutes to 1 hour. If somebody is taking calcium iron supplements during the second half of pregnancy, then that should be given after a gap of at least 4 to 6 hours. So these are again very simple steps. So if we are able to follow these basic steps, most of the pregnancy related complications that can occur related to thyroid disorders in pregnancy can be avoided. Thank you.